Welcome to our channel. Coronavirus symptoms. What are they and should I call a doctor? What are the symptoms caused by the COVID-19 virus? How does it spread and should you see a doctor? What is COVID-19? It is caused by a member of the coronavirus family that has never been encountered before. Like other coronaviruses, it has transferred to humans from animals. The World Health Organization has declared it a pandemic. What are the symptoms this coronavirus caused? According to the World Health Organization, the most common symptoms of COVID-19 are fever, tiredness, and a dry cough. Some patients may also have a runny nose, sore throat, nasal congestions, and aches and pains or diarrhea. About 80% of people who get COVID-19 experience a mild case, about as serious as a regular cold, and recover without needing any special treatment. About 1 in 6 people, the WHO says, become seriously ill. The elderly and people with underlying medical problems like high blood pressure, heart problems or diabetes or chronic respiratory conditions are at a great risk of serious illness from COVID-19. In the United Kingdom, the National Health Service has identified the specific symptoms to look for us experiencing either a high temperature, you feel hot to touch on your desk or chest, and you continuous cough. This means you have started coughing repeatedly. As this is viral pneumonia, antibiotics are of no use. The antiviral drugs we have against flu will not work, and there is currently no vaccine. Recovery depends on the strength of the immune system. Should I go to the doctor? I have a temperature or a cough. No. In the United Kingdom, the NHS service is now that anyone with symptoms should stay at home for at least 7 days. If you live with other people, they should stay at home for at least 14 days to avoid spreading the infections outside the home. This applies to everyone, regardless of whether they have traveled abroad. In the United Kingdom, you should look on the dedicated coronavirus NHS 111 website for information. If you get worse or your symptoms last longer than 7 days, you should call NHS 111. People will no longer be tested for the virus unless they are in hospital. Many countries have imposed travel bans and lockdown conditions in order to try and halt the spread of the virus. You should check with your local authorities for the latest advice on seeking medical assistance. How many people have been affected? China's National Health Commission confirmed human-to-human transmissions in January. As of 25th of March, more than 425,000 people have been infected in more than 150 countries, according to the Johns Hopkins University Center for Systems Science and Engineering. There have been over 18,000 deaths globally. Just over 3,000 of those deaths have occurred in mainland China, where the coronavirus was first recorded in the city of Wuhan. Italy has been hardest hit, though, with over 6,800 fatalities. Many of those who have died had underlying health conditions, which the coronavirus complicated. More than 150,000 people are recorded as having recovered from the coronavirus. Why is this worse than normal influenza, and how worried are the experts? We don't know yet how dangerous the new coronavirus is, and we won't know until more data comes in, but estimates of the mortality rate have ranged from well below 1% in the young to over 3% among those who are elderly or who have underlying health conditions. Seasonal flu typically has a mortality rate below 1% and is thought to cause about 400,000 deaths each year globally. SARS had a death rate more than 10%. Another key unknown is how contagious the coronavirus is. A crucial difference is that, unlike flu, there is no vaccine for the new coronavirus, which means it is more difficult for vulnerable members of the population, elderly people or those with existing respiratory or immune problems, to protect themselves. Hand washing and avoiding other people if you feel unwell is important. Have there been other coronaviruses? Severe acute respiratory syndromes, SARS, and Middle Eastern respiratory syndrome, MERS, are both caused by coronaviruses that came from animals. In 2002, SARS spread virtually unchecked to 37 countries, causing global panic, infecting more than 8,000 people and killing more than 750. MERS appears to be less easily passed from human to human, but has greater lethality, killing 35% of about 2,500 people who have been infected. That's it. Take care of yourself and your family. Thank you for your attention and hope to see you here soon. Bye bye.